I'd like to shift over to our PBO officials that are here with us. Thank you for joining us. Bill C-3 is a cut and paste bill. A minister was elected on April 28th. Within a number of days, possibly a week or two, she was appointed a minister. Just a couple of days after that, she changed the title of the bill, C-71 to C-3. Have you seen any change? Have you done an update on the numbers that you have provided us? It's still about 115,000 people that are going to be affected.
Thanks. So we've looked at the legislation, and it seems to be substantially the same as the previous bill that we costed for the previous Parliament, and that cost estimate was prepared in December. I noticed that during the minister's earlier testimony, there was a reference to updated numbers with respect to 4,200 claims coming in. We haven't seen those data, so potentially we could circle back and update it. I would say that, substantially, we wouldn't be here at committee today if we weren't confident in the numbers that are currently on the website.
I tend to believe your number.
Yeah. If it wasn't useful for parliamentarians, we'd take it down.
Have you done any estimates on how much these new Canadian citizens by descent would cost taxpayers in extra social and healthcare costs?
No, we have not. The cost estimate is squarely focused around the cost of applications and processing.
Okay, so it's about 115,000 people. We don't know what the impact this is going to have from a cost perspective. Have you done any estimates on what it would, how this would impact the job crisis that we're currently facing in Canada?
Not specifically with respect to this legislation. If it is the will and the interest of the committee, obviously the committee can pass a motion, and we'd be happy to go back and prepare additional estimates on this.
Thank you, Mr. Jacques. Thank you, Mr. Medagakis.
Thank you, Madam Chair. Thank you to all the witnesses for being here. I first have a question for the Parliamentary Budget Officer. Earlier, I asked the Minister how many people C3 could potentially affect and create new citizenship. She was unable to give me a figure, but your department is able to come up with a figure. So shouldn't a minister who introduced the bill know the figure? What's the difference between how IRCC and your department does this work, this calculation? The figure we have is an estimate, of course. When we look at the estimates on the Canadian diaspora, it might be 300,000 or it could go up to 4 million. So what we did is we looked at a Statistics Canada study. It's a demographic study from 2018, and it rebuilds from 1921 to 2016, the Canadian diaspora divided into 3 groups, including citizens by descent. So we took that study, and with some assumptions, we've gotten to our figure. And you were able to estimate the cost of $20.8 million. How did you get to that figure? $20.8 million. We looked at the 4 groups that would have been affected by C-71 at the time, and what we did is we asked certain departments that how much it had cost to deal with grants of citizenship. We also communicated with GAC to get some figures on consular services for regular and extraordinary cases, like, for example, a war. And then we just multiplied all of those costs, and we arrived at the figure of 20.8 million. And we know that Prime Minister Carney asked all of his ministers to make cuts. Do you think that IRCC has enough resources currently to process everything, all the applications under C3 if it does pass? Do you think that right now they have sufficient resources at IRCC to process all of the potential applications? We haven't assessed the department's budget. It's difficult for us to say if they have enough resources or not. Okay, thanks. Did you get any assessments from IRCC about the number of people that would be affected, about the cost? Did you ask any questions? Did you get answers? In October 2024, we sent a question to the department to find out if they had any estimates on the number of people who would be affected by C-71, and the answer was no, we don't have any estimates. They also gave us some suggestions about how to come up with an estimate. So they didn't have any figures. They told you. Not to our knowledge, they didn't have any estimate, no. Earlier on, I reminded the minister how the Immigration Act works, because she said the 1,095 days, that is fine, was based on the same 1,095 days requirement for permanent residency, but she had forgotten that those days have to occur within 5 years rather. Do you have any figures? I imagine you don't, but I'm just wondering, would you be able to calculate the same figures if you looked at that requirement, the 1,095 days over 5 years? For the moment, there's no specific hypothesis for the 1,095 days. We have a hypothesis that reduces the number of Canadians potentially affected, because theoretically more people may be affected by the measure. And when it comes to the question from immigration, I imagine it's just a question of data. It's difficult to obtain that data. I can't really provide an answer. Mr. Chapman, do you think that there are cases of lost citizens that would not be covered by C3?
And there are. It does not correct all
15 seconds.
It does not correct all the categories, but it comes very, very close. And you know what? There are always going to be problems.
Thank you, Mr. Chapman. Thank you. Merci, Monsieur Brunelle-Duceppe.
Thank you, Mr. Brunelle-Duceppe. Thank you, Madam Chair. As lawmakers, we're trying to get as much information as possible. That's why you're here with us. I'd like to come back to the number of people affected. When I heard 115,000, I can imagine it was complicated to create a framework of analysis to come up with that figure. Were there other scenarios where fewer people were affected or more people were affected? How did you land on the 115,000? Can you tell us if it might be much higher or much lower? As I said earlier, our analysis is mainly based on a StatsCan study. And in the study, there are 3 levels of estimates. We chose the middle one. There's one that is lower. We could have the figure. And then the other one is higher. It's 1.5 times the figure. So in that case, the Canadian diaspora who would be citizens by descent would be around 2 million. And then in that case, 1 million people would be Canadian citizens by descent, or it could go up to 3.4 million. So we could look at those figures that we came to and either halve them or multiply them by 50%. So that's the range that we were looking at. Now, the next question is, who is going to apply? So we also came up with estimates about that. We think our estimate is reasonable. It could be higher, it could be lower. And I can imagine that a lot of those people might come from the U.S. People from the U.S. may be more likely to apply. It's possible. You didn't do a breakdown per country? No. We could refine it, but we came up with an aggregate number. Do you think it's reasonable for the minister to arrive without being able to tell us how many people would be affected? It is not up to us to say. Thank you, Mr. Jacques. Thank you, Mr. Brunelle-Duceppe. Thank you, Madam Chair. Thank you to all the witnesses. We had very different opinions and a lot of very relevant information to help us make an informed choice. Mr. Parliamentary Budget Officer, you said you calculated the cost of $20.8 million based on research about the 1,095 days. Earlier I mentioned that before 2019, exits from Canada were not taken into account. Same for flights. Did you take that into account? And if you didn't, do you think it would be even more worth your time to really verify that 1,095 days? No, we didn't take that into account. Very few details were provided before. It's an excellent question. It's something that we should definitely consider, but I can't give an answer. Okay, is it something that you could take into account in an analysis? It's the kind of thing that we don't always keep in mind when we have many files to juggle. Yes, if there's a request made from the committee, we'd be happy to provide that estimate. We are here to support you. You are our clients.